Okay, thank you. Yes, someone has just said, well said, Primrose. I mean, everything that Primrose said in that video was sort of, you know, heartfelt, thoughtful, you know, just important things to hear, I think. Because of the way we had to cut the video, there was one of my answers that you couldn't quite pick out. And she was talking about how do we help people to express themselves when they are, on the face of it, strong and coping, but are in pain and suffering underneath. And I think I empathised with Primrose over that because, you know, I'm a guy, I feel some ridiculous inner pressure to be strong and tough and keep going and those sorts of things. And I was thinking about what can we do to engage with people who, on the face of it, say that they're fine when they're not feeling so underneath. I think the first thing to do is just to make sure that you double check and that you really ask people in a way that helps them feel that you're really asking them how they are. You're not just saying, are you all right? And they say, yeah, I'm all right. And that's the end of it. So there's something about asking with care and connection and authenticity. And then remembering that empathy isn't just about thinking, how would I feel in that situation? Because you not only have to think about how would I feel, you also have to think, what are the differences for that person versus me that mean or would cause me to have to see it differently from their point of view? And I think that's that perspective taking and understanding from someone else's point of view. You can't get that from a graph or a correlation or a research paper. You have to try to understand it from the people concerned. And I think several of the people that have contributed to this year's conference have said that you also need to tread carefully when you're asking people about their experiences, because you can be stepping straight into trauma. And that's as true for racism, for sexism, for all other inequalities and protected characteristics, where these might be things that are difficult for people to talk about straight off, particularly if you don't know them that well. So there's something about developing trust, about allowing people to maintain their boundaries and allowing them to speak as much as they're able, but without pushing people too far into trauma. So I'm really grateful to all our contributors who've agreed to be interviewed, and of course we've recorded all the sessions of this conference. They'll all go up online so that you can look at them subsequently, but also forward them within your own organisations and circles so that other people can benefit from that content and also see what we are doing and trying to do and planning to do in Bristol Health Partners. So we need your feedback. I'd just like you to have a quick look in the chat. There's a guide to allyship, which is a guide that I've used, which I've also shared with several colleagues from Black, Asian and minority ethnic backgrounds. And that guide has been sort of interesting and thought-provoking to all the people that I've shared it with. So I've sort of tested it out with a few colleagues that I trust and respect. So I feel confident sending that to you. It's a challenging read, but I hope you benefit from looking at it. There's another link that's about to come up, which is a link to the HIT conference survey, and we'll put it up now, and I hope, and we will put it up at the end again. This is for you to complete the feedback on the conference that we've run this year. We really, really appreciate feedback. I know it's a bit of a faff to fill in when you've The conference is coming to a close, but we really need your feedback. This is our public engagement, this conference. This is a really important part of our calendar and of our year's work. And so we will value, review, count, and look at the responses that every single person puts into that that feedback survey. So our theme today has been a call to action. It's been reflecting on the impact of COVID on different communities. We've seen in health, as Andrea said, that we can move quickly and effectively to change services. So we can do that again, I hope, for the better. And it's something the health service is constantly changing and constantly learning and constantly adapting to the challenges that we find ourselves in. I think this is also a moment for us to feel lucky, pleased, proud of our health integration teams. I've been more involved with some of the health integration teams than others, but you know, they all have their own unique characteristics, but they are all also joined in trying to improve the pathway for people using services, and to do that in a way that is led by service users, clinicians, and academics and commissioners. So really taking all parts of the system to think about those pathways. The interviews this afternoon have raised so many things. I almost feel like I can't summarise all of them in one, and it would probably do them an injustice to do so. Rosie, you've made a comment in the chat about sort of sharing our own vulnerabilities and holding that alongside what our competencies are as well. So I slightly feel you saying that to me, and I take it on board, but also you're sharing it to everyone. I would say that we connect through our vulnerabilities. Nobody connects with a perfectly constructed human being who's only got a sort of front, a perfect front. We connect with people's idiosyncrasies, their sort of bits that they find difficult, their personal difficulties that they might share that makes you feel like you've been through something similar. And so I think that bringing your whole person to work, which is what Andrea suggested, I think is definitely something that I'm taking away, reminding myself how important that is. So from our point of view in Bristol Health Partners, we've got some actions to make progress on some of the topics and challenges that have been raised today, particularly around equality, diversity and inclusion. And we are producing, as we speak, an equality and inclusion strategy that we want to collaboratively develop with service users and the public and people from a variety of backgrounds. So we are talking specifically about people from Black, Asian and minority ethnic backgrounds. And I'm not totally keen on that term, but it's in common use. So that's the point about us engaging with a variety of people, particularly those for whom this equality and diversity and inclusion strategy will be so relevant. We're going to look for opportunities across the HITS to share learning, to share resources, and to share ways of working. And it's been great to have the feedback on the platform that we've used today. It's nice to hear that people have enjoyed participating in that way. It's different. It's not better than face-to-face, but it's different, and there's something positive about that. So we're going to put updates on all the actions, all the other things that we're doing. There's a lot going on in Bristol Health Partners right now, and the updates on that will all be going onto the website. And also you can follow us on Twitter, as I know many of you do. For the health integration teams, you'll probably all be needing a quiet lie down for a moment after the conference over this week. I certainly will. But there are things for you guys to reflect on, to think about how you might do differently. You know, hang on to those insights that you've gained about how some people might find it more difficult than others to come to services, how some people might communicate in different ways, have different preferences. Lots of the HITs are already doing that, didn't need this conference to remind them to. So I know that it's part of the work plan for many of the HITs. And in particular, the Adverse Childhood Experiences HIT will be running a session soon looking at equality, diversity and inclusion in trauma-informed approaches to care. So there's also a study on this which has been referenced by Katrina in the chat. So what about you guys? You have been paying attention, concentrating for 4 days in the conference, listening to lots of people talk, involved in your own discussions, hopefully discussions at home. So you could think about what you're doing. Tell us what you're planning to do. Engage us. Email us at hello@bristolhealthpartners.org.uk. You can go onto the website as well, which is where you can find recordings. But you could also think about your role as an ally. Now, being an ally isn't just about being a white ally for people from BAME backgrounds. It's being about an ally for anybody who's at a disadvantage. You know, there are many protected, 9 protected characteristics which you can think of, some of which are less visible than others. But being an ally is an important role, probably for all of us, in different shapes and forms. So it just leaves me to say thank you to quite a few people who've been involved in the conference, particularly our speakers, many of whom have shared very personal experiences for our benefit. So not just Andrea, Zoe and Primrose this afternoon, but David and Andrea on Monday, Robert Leckler, Adam Finn, Andaloris Chacon, Asher Craig, Leah Ovens and Dan Magnus. I think I should let you know that when we first set up this conference, we were trying to shoe a lot into it. And we had some very thoughtful, at times blunt, but very helpful input and review and collaboration from Katie and Stephen, who challenged us really to think about what the primary themes were for the conference and helped us shape it into something that was much more coherent. And then Katie and Stephen have obviously been involved in the last 2 days and then have come on today, so I'm very, very grateful for them. Autumn Live have run the whole conference behind the scenes. So Jasmine, Simon, Jan and Mikey, we've really valued your technical support and sorting out the problems as we've gone along. But the biggest thanks really goes to the Bristol Health Partners core team. In particular, Louise Osborne, who's led the organisation of quite a complex programme with her usual efficiency and clarity and humour and quick action and just sorting everything out beautifully. But the full team includes Lisa King, who hasn't been able to join us, but Sabrina Lee, Carla Southworth, Rachel Allbless and Trish Harding. Trish is going to be looking at your feedback, so you must send that in. Finally, Ollie Watson, who is understated, always smart and efficient on absolutely everything. He's been kind to those of us that have sort of messed things up and needed extra help. He's psychologically minded, and that is, I find that really positive to work with Ollie. Thank you. His briefing notes are excellent. It says you don't need to read all this out. oh, sorry, Ollie wrote the briefing notes as well. But that was my feedback to Ollie, so thank you, Ollie. I know the team are excited to keep working with you guys, to keep engaged with you. They will continue working with the health integration teams, providing all the support for project management that you guys need. And we hope that you'll be able to keep the themes of today in your mind as we go forward over the next few months and year. So we hope the sessions have helped you have some new ideas, build some new connections. We've learned really, haven't we, that COVID-19 didn't level us. It didn't. It was unfair, and it was actually worse for the people who were worse off to start with. But what levels us is our humanity and our understanding and kindness to everyone, but especially to you if you're struggling and finding things hard or struggling to be heard. We've been reminded that we're not all the same because we all have different needs and different challenges and different advantages. But despite that, we should all get the same fair access to treatment, justice in life chances and in things like employment, and to be respected and valued regardless of what our background is. We've realised actually that we've been maybe half asleep on the job in relation to some issues like racism, injustice and other inequalities. We need to be a bit more brave. We need to lean in, take some risks and take positive and assertive action on all the inequalities wherever we find them. So thank you very much for engaging with the conference. I hope that Bristol Health Partners has done what you needed over the course of the last few days. We keep taking advice, we'll keep being forward thinking, we'll strive to remain relevant and offer the best help we can to people. We'll try and shape our partner organisations in the right way, and we will be kind and understanding to everyone that we work with. So what will you do? Think about the poll and do one of the things from the poll. Learn about something, becoming an ally, and then tell us about what you're doing and what you've done, and we will stay interested and engaged. So we hope that you will look after yourselves and each other. We've missed seeing you face to face, but it's been a good conference. We'll be back next year. So in the meantime, as the nights draw in and the mince pies start to appear on the shelves of our shops, I'd like to be the first to wish you all a very Merry Christmas. Goodbye.